am going to be talking to you guys tonight about a 22-year-old male. He came to me actually, his mother actually and him are very close, and his mother found out about me through one of her friends. So that's another way you're going to get patients, guys, is your word of mouth referrals are like your biggest advertisement sometimes. The mother actually was really down because she said, we cannot find any way to get him feeling better. And, do you work with ADHD and anxiety and depression, and do you do something different than Western medicine? And my answer was, yeah, absolutely. I mix a lot because I do have a foot in primary care. But functional medicine is the core of what we do. So here's his case. He's a 22-year-old male. He's diagnosed with ADHD, depression, and chronic fatigue. 10-year history of low energy, anxiety, low motivation, despite psychiatric treatment and normal routine labs. And when I say psychiatric treatment, I mean counseling, so cognitive behavioral therapy, along with medication management. So he's been getting both. He's got suboptimal sleep, very low physical activity, limited plant intake. And again, this prompted him to seek the integrative approach. So he basically, as far as medication goes, he was taking Wellbutrin, extended release, and methylphenidate. So he was taking the bupropion, Wellbutrin for his anxiety, depression. He was taking methylphenidate, extended release for the ADHD. So he's riding a little bit of a roller coaster with that. And the psychiatrist had also given him some as needed anxiety medication too. So whenever I see that, I get this almost cognitive dissonance because you've got uppers and downers and in-betweeners that these patients are on. And I know a lot of you are probably nodding your heads. Yep, we've seen it. So for anxiety, we're going to give them something like Boost Bar to just calm them down. Then the Wellbutrin for the underlying everyday anxiety, depression. Oh, then let's give them a stimulant for the ADHD. So, when does it stop, this cocktail of medicine, and when do we get to the root cause?
Every time, essentially, we are stressed, stuck in traffic, physical injury, or a pain. It could be multiple things, but could be also perceived stress, something that for you and I might not be as stressful, but it's perceived as high stress for some of our patients. So that activates our HPA axis, which is hypothalamus, pituitary, and adrenal. And adrenal, at that point, will start secreting it'll trigger the fight or flight, but it also secretes cortisol. That's why you see the cortisol there in the middle. These are the pathways that we refer to when we have a patient that have persistent stress, either chronic stress and chronic activation of the HPA axis, which what you will see in the lab test when Dr. Kim is going to share with you the result is elevated cortisol. And that's what happens often where we have, every time we are stressed, we secrete cortisol. And you can measure that in the test. And Dr. Kim will talk more about that. But in a state of prolonged stress, our nervous system goes through, there's like 4 different steps, but it goes through initially through this adaptation to the stress. And that can directly influence our mood, our energy level, our different systems in our body. So on the left side, from cortisol, if you have ongoing cortisol, elevated levels of cortisol, it could directly interfere with the neurotransmitter system and brain regions that are responsible for the regulation of our mood. And so physiologically, you could have a situation which there is an impairment of the signaling of serotonin. That is due to reduction in serotonin synthesis, altered serotonin transporter activity, and also reduced sensitivity of the serotonin receptor. So he might be taking SSRIs. The serotonin receptors have reduced their sensitivity. So he's not getting the same response to the available serotonin. You might also have an impact on GABA. So cortisol can suppress the inhibitory GABAergic signaling, which lowers the ability of our brain to essentially self-regulate or calm itself. So you get like this inner anxiety sensation, anxious sensation. Essentially, every time you got cortisol secretion, it's antagonistic to melatonin, which is important for healthy sleep. So every time you got cortisol increases, it also decreases your melatonin. When you look at a patient's lab and you see that the cortisol is elevated, is higher than it should be, just know that it's probably disrupting their normal release of and synthesis and release of melatonin, and disrupt the circadian rhythm, because that's what cortisol does. Cortisol is supposed to be higher in the morning and very low in the evening, because that's where we're getting ready to sleep. That's where our brain is starting to get, and our bodily system starting to get ready for sleep. We have a whole class on each one of those branches, which is like 2 hours, just a deep 2-3 hours, just a deeper dive into each one of them. But if you see a patient that having troubles falling asleep, have light restless sleep or morning fatigue, it could be one of those common reasons is that their HPA axis just not working well, or they secrete cortisol. That could happen for multiple reasons. But now you understand how a disruption in the HPA axis, over secretion of cortisol, can interfere with all of those different systems, with the neurotransmitters, with this energy production, and our natural circadian rhythm. So now that we understand that, Dr. Kim is going to take us into what we actually found, what she actually found in this patient's lab. And Dr. Kim, probably important to mention that the comprehensive adrenal is different than measuring cortisol in the standard of care, which is a blood test in the morning, right? So you want to maybe, maybe mention a little bit about that.
Yeah, I see a lot of my Western medicine colleagues say, oh, we can check your cortisol, no problem. And it's a one-time spot check. Hopefully it's in the morning, but we're not really sure what time the patient woke up, right? So that doesn't really tell us the full story. And you're going to see exactly why. And like as probably a split second when I show you his lab, because I'm going to show you how we tested it throughout the day, because it matters when you wake up. And you should have a cortisol spike when you wake, and then that spike raises you up, and then your cortisol should stay nice and kind of high in the morning, and then you're going to start coming down slowly all day long. And we want to see that whole day's worth of cortisol to see if our patient is flatlining high, flatlining low, or are they just right, So if a patient's really high, then we worry about, oh my gosh, this patient's just, his cortisol levels are high. His adrenals are just spitting out cortisol all the time, all day long. And the thing that happens after they run out of energy and they just overwork, then it goes flat. So we caught him before it had gone flat. If it goes flat, then that's a whole another thing. Then you've really got full on adrenal fatigue, because the adrenals are so tired of spitting out cortisol, they're not going to spit out much more anymore. The box at the far left is 7 a.m. to 9 a.m. And then their second point is 11 to 1 p.m. The next point, and this is going across the bottom axis, the left to right axis, the third dot is 3 to 5 p.m. And then the fourth dot is 10 to 12 a.m. Okay. And then the up and down axis is just cortisol levels. When we look at the green is the cortisol trajectory that is our goal. Okay. So we want somebody to wake up, and then it comes down, that second hash mark 11 to 1, it comes down, kind of almost looks like an arm, and that's the elbow, right? So it comes down quite a bit from morning to noon. So morning to lunchtime, you really start to dip your cortisol levels, and then they slowly dip down to their lowest in time for bed, which makes sense because cortisol, as Dr. Tao was saying, it will antagonize and kind of stop the effects of the relaxation response. So we want less of it at night when we're trying to go to sleep. The green is good, right? Then the yellow and the red are kind of danger zone of low or high. Now let's look at the black line here. This was my patient, and this is not good. So he started off the charts in the morning, high cortisol. He's way above high. He's way above the red, see? Then he stays in that high zone. At lunchtime, he is still way higher than he should be. Look at the goal, all the way down. So second hashtag over. It's kind of where the elbow of the arm is. He should be way down there, and he's way sky high, right? Then at 3 to 5 p.m., okay, now it's dropping, but it's not dropping nearly where we want it. It's still way too high. And then at 10 to 12 a.m., so his bedtime measurement, he's still way above goal. So if you see where green is and you see where the black line is, you can clearly see his cortisol levels are way too high. And to me, I'm like, yep, this is kind of what I thought. And I will tell you, he is not the first 20 something old male that I've seen recently with these issues. And we've had tests that look like this. So, I mean, these kids have been really stressed. The opposite of cortisol, think of the cortisol balancer in your body is DHEA. Okay. Now, DHEA can serve a lot of roles. It can be actually very protective for your body and anti inflammatory in a lot of ways. It can be cancer preventative. There's lots of great studies on it. It's important. It's just as important as the cortisol. These two are counterbalances. That's why they measure DHEA on this test as well. So his DHEA earlier in the morning was measuring quite high. And then it was measuring kind of the cortisol DHEA ratio was measuring kind of in that yellowish sort of high range. So what that tells me though is he is trying to keep up. His body's trying to spit out a lot of DHEA to keep up with all that cortisol, but it's going to run out soon. And that's how the whole thing works. And then once you go into full adrenal fatigue, that black line you see that's elevated is going to go lower. Okay. So he definitely, I mean, I'm like, well, we found something here. And it's very, very significant because guys, until you fix the hypopituitary axis, the HPA axis, the hypopituitary adrenal axis, until you fix that, you're probably not going to be able to fix a whole lot of other things on your patient when they're dealing with things like fatigue and depression and anxiety. So he comes back, he's doing all of this stuff. I saw him probably 3 or 4 times during this time period, just checking in. And the 3-month follow-up, he told me, he's like, I can't believe how much better I feel. I have a lot more energy, more motivation. I'm actually like getting inspired for life and wanting to get out of bed. He said, I feel so good. I just quit taking my ADHD medicine. And I was like floored. Like I didn't expect that. That's part of the reason why I'm sharing the case though, because this is quite remarkable. But he's like, I just stopped it. I didn't feel like I needed it. So we have made big progress in 3 months. So remember where the black line was. It was nearly at the top of the box, like nearly at the, like he was maxed out on his cortisol. And now things can happen in the afternoon. If they get a little stressed or they might get a little bump. He's not at green, but he is so much better than he was. And we haven't rechecked it the 3rd time, but he is reporting feeling so much better. And that cortisol level has greatly dropped. And now it's even doing something that looks like the slope where it's higher in the morning and coming down to low. And at nighttime, he's almost in the green now. So he's really corrected that quite significantly. And so basically we're going to repeat. He's doing 3 more months of the regimen, and then we're going to repeat that one more time. Now, he had gone off all of the HPA reset supplements. So he was only taking core supplements and doing lifestyle for 2 weeks before we rechecked this HPA axis. So this is not reflective of like same time dosing. Like he wasn't doing the repair anymore. He was pausing it for 2 weeks so we can measure where he's at. So that's where, I mean, it's like rebooting a computer. It's miraculous. It gives your brain baby nudges into the right direction. So I thought this was just a really powerful example to show you. He has me managing his medication. He's not taking ADHD medication anymore. He's not even taking the as needed anxiety medication anymore. Still on the Wellbutrin, but we've pulled 2 meds off his list by correcting the HPA axis. And, we're still working on it. So I'm very confident he's going to come down to that green level. And it's pretty amazing to do this. And otherwise, I think of if he had not come to functional medicine, where would he be? Trying all the different cocktails of medicine still, just trying to just get this kid better with medication after medication or different, not that therapies are bad. He still sees his therapist, but until you fix this stuff, it's going to stay the same.